Can you guess the stage of modernity ruling this era? Well, we are living in the 21st century that has shifted everything from hands to machines. Here, everything means every little thing. Now, the machines are taking over the workload from men-force and replacing them in efficiency and output. The same goes for the medical world. This is Earthy Perks, with a new episode portraying the shift from using respirators to modern ventilators. Amidst the coronavirus conditions, one word that revolved around ventilators. The patient who got into severe symptoms of the viral attack was shifted on ventilators to give external breathing aid. By definition, ventilators are modern-day breathing aid systems that help breathe fresh air and oxygen and give out foul carbonated air. Years back, when medical technology was not at its peak, caregivers and doctors facilitate the patients with disrupted breathing problems. They were given aid in the form of respirators. The respirators were a mask or device provided to the patients for filtering out dust, bacteria, and fumes. This device was worn over the mouth and nose. As the technology made an overture in the medical field, new respiratory aid systems were created, considering the necessity of the patients. Out of them, one is the ventilators. Ventilators are used for providing mechanical ventilation that is itself life-saving. It works by pushing the air in and out of the lungs. Ventilators come along with a plastic tube that is inserted into the windpipe, or trachea. This pipe can be inserted in two ways, either from the nose or via the mouth. Depending on the duration of mechanical ventilation, sometimes for longer durations, the pipe could be inserted directly by making a small incision. This procedure is termed tracheostomy. Once the tube is inserted into the trachea, the other side is then connected to the ventilator. It further depends on the condition of the patient and the requirement that determines the mode of ventilation. As soon as the patient recovers from the underlying respiratory problems or lung dysfunction, doctors decrease patients' dependence on mechanical ventilation. But not every patient requires complete mechanical ventilation support. Some people are provided with tight-fitting masks and given a pressurized mixture of oxygen and air. This pressure is adjusted to facilitate the patient's breathing pattern and avoids imposing fatigue on the respiratory system. The phenomenon is termed as bilevel positive airway pressure, or BPAP, or continuous positive airway pressure, or CPAP. Sometimes, using mechanical ventilators is dangerous for people, as it is a machine, so adjusting the right pressure and volume is the real strategy. But if too much pressure or a high volume is given to the patient, it would stretch out the lungs and cause permanent damage. It could also cause rupture of alveoli that in turn result in lung collapse, scientifically termed as pneumothorax. In another case, if too low pressure or low volume is given, it would increase carbon dioxide levels in the blood and lungs. It further causes the alveoli to close and leads to death. Another complication of using mechanical ventilation is the agitation controlled by drugs, i.e. propofol, lorazepam, and midazolam, or opioids, such as morphine or fentanyl. All the drugs are used to relieve breathlessness. Moreover, intubation may also lure bacteria to travel from the mouth and nose all the way down to the trachea. It could lead to severe infections. This is why doctors always consider every situation and their health before deciding on using mechanical ventilation. With emerging medical technology, patients do get appropriate medical care, yet not everything can help. The same goes for mechanical ventilation. On the one hand, it is a lifesaver. On the other hand, it can be dangerous in several circumstances. On this note, this is Earthy Perks signing off. Stay tuned and keep watching Earthy Perks.